Doctors of Reddit, what's your thank god they came in for a second opinion moment? I've had a couple of gems, but the one that really sticks out in my mind actually happened about a month or so ago. A young mother brought in a 6-year-old to emerg. She was super nice and apologetic because she thought that she was wasting my time, because she said that her son had started to develop different spots all over his body and she has no idea why. My initial first thought was chickenpox, so I had some swords and shields up ready to go for the anti-vax debate, but she claimed that she had her son vaccinated at all stages up to that point, and upon closer inspection they were massive clusters of warts. Not uncommon, but because of how rapidly that they were growing, I ordered some blood work to make sure there wasn't an underlying cause, as kids' immune systems are pretty well equipped to handle that sort of thing. And I'm really glad that she brought him in, because he had a severely low white blood cell count which revealed a primary immune deficiency disease. This is my second story to post here, but a great story no less. Mid-30s man walks into my office with what looks like a black eye and a broken blood vessel in the front of his left eye. He went to his primary, and it was simply assumed that he got punched or hit or something, and he was dismissed. He was noted to have high blood pressure, but a script for medicine was written, and a follow-up in a few months. Gentleman comes in to see me to get another opinion on the matter, and I look at him and immediately start the line of questions. How long has it been there? Do you have a headache? And when you plug your ears with your fingers, do you hear a whooshing sound? He had a cavernous sinus fistula CCF. I sent him directly to the emergency room with his family of 4 in tow, and he was in there, or within an hour of arriving. Saved his eye and possibly his life that day. The best news, he was a kitchen guy at my local diner which I frequent, and they still treat me like royalty there when I come to eat. They all remember the time I saved one of theirs. This guy was told he had pink eye. He had metal shards in his eye from welding. This is a I wish I had gotten a second opinion story. I had a doctor in high school who wasn't concerned when I suddenly developed vertical double vision, which was freaking out everyone in emergency, where I had gone initially and lost 60 pounds for no reason. It was only a year or two later when I told him that my arm would fall asleep much faster than normal when I raised it to ask a question in class, that he thought there might be something wrong with me. MRI ordered. Brain tumor found. I've heard people say sudden, unexplained weight loss is always a red flag. Sucks no one picked up on it. My grandmother had her hip replaced, but the hip always hurt to her. She waited a year, hoping it would go away, but it never did. She asked multiple doctors and did multiple x-rays, but doctors said the replaced hip was fine. We finally made her go to a private clinic in my hometown, and the doctor saw that the replaced hip was fine and dandy, but the bone around it looked like it was a tad bit eaten by bacteria. So the new doc did an operation, and there was so much pus in the leg it was insane. If my grandmother waited any longer, her blood would become infected, and she would have died. Thank goodness she went to the clinic. My dad, a pediatrician specializing in neuro issues, was seeing one of his patients at the hospital. Got dragged into the NICU unexpectedly by a nurse who insisted a baby wasn't well. The attending doc insisted the kid was fine and just tired from a difficult vacuum assist delivery. My dad could tell the baby wasn't okay and managed to talk the parents into a brain scan. The NICU doc insisted my dad was nuts to the parents. Dad was right, and the kid had a brain bleed and was rushed to surgery. The baby would have died without the nurse bringing my dad in and the parents listening to him. As is, that extra time almost certainly cost brain function. A nurse in the NICU caught that one of my twins had a severe UT. She caught it based on his eating patterns. I'm grateful for those parents the nurse brought your dad in. One of my sister's friends was diagnosed with cancer at age 10. They were advised to pack up their stuff and move across the country to go to a specialist because they would have to stay there for at least a year. They even had to hire a private plane so she wouldn't get sick on the plane from any passengers. Well, before they left they got a second opinion saying it was pneumonia. Then they got a third that again said it was pneumonia. Now several years later she is healthy and never got cancer treatment and has been tested for cancer regularly. I have been diagnosed with cancer several times, but all have been wrong. Thank God. Same here. I'm on 3 diagnosis and 0 actual times of having cancer. Dermatologist here. I have seen probably 5 instances of my other doctor told me it was fine. That were melanimous. A lot of times people don't want a full skin exams. There are lots of perfectly sane reasons for this. Time, perceived cost, history of personal trauma. However, I routinely find cancers people don't know they have. Keep this in mind if you see a dermatologist for acne and they recommend you get in a gown. I went to my former doctor about a mole on my arm that I thought had gotten larger and asked him to biopsy it. He looked at it carefully and told me it was fine, but I insisted and things got a little testy, but he did it. It was a malignant melanoma, and had it gone 1 millimeter deeper it'd have been grounded for 5 years from my pilot job at best, or suffered dire health consequences at worst. After a surgeon removed a big chunk of my arm excising the melanoma and surrounding tissue, he told me to be sure to thank my regular doctor for saving my life. In the time since I've become well acquainted with your specialty as my first line of defense, having moles mapped and checked every 6 months for a while, and now every year, it sure as hell isn't all botox and laser hair removal. Not a doctor, but the patient. Went to my family doctor with the worst headache of my entire life. She dismissed it, telling me it was a tension headache, and that I should take a Tylenol, and lay down in a dark room. Over the course of the next month, I saw her a total of 13 times, each time with worsening symptoms. First it was dizziness, then vomiting, then eventually I could no longer see out of my right eye. Every time she told me it was just a tension headache or a weird migraine, gave me a prescription for painkillers, and sent me on my way. The final straw was when I was no longer able to walk properly. I would try to take a step, but all I could manage was this weird shuffle. She reluctantly agreed to send me to a neurologist. The next day I showed up at his office and was in there for less than a minute. He took one look in my eyes and immediately called an ambulance. Turns out I had hydrocephalus. My ventricles were 5x the size they were supposed to be, and my brain was literally being squeezed out of my head. Go figure. FCK man. I hope you reported your family doctor for medical malpractice. Had a patient come in for therapy after his PCN yelled at him for being a hypochondriac and saying his symptoms were all in his head and that he was just trying to fish for disability. His symptoms were pretty obviously neurological, so I referred him for an MRI. To my shock, he had only ever had x-rays. Sadly, I had to tell the 19-year-old man that he had multiple sclerosis. With great satisfaction I got to tell that PCN he done goofed and that I would be talking to our mutual chief of clinical services about the incident. Edit. 1 Thanks for the silver. You all rock. A nurse here. Had a lady in for simple pneumonia. Her 13-year-old son was getting bored, so I showed him some equipment. I connected a simple heart monitor to him and discovered he was in a complete heart block. I printed a strip and showed it to the document. We suddenly and unexpectedly got a cardiac patient. This is some Grey's Anatomy sheet. House knew all along and used playing with the child as an excuse. All because the kid wore mismatched socks. In an emergency medicine doc in the Midwest, use of patient was transferred from rural nowhere to our tertiary care facility big hospital with every specialist. Call was of really bad quality, but the transferring physician described a 21-year-old male that had rapid heart rate and breathing rate, low blood pressure, low oxygen, confusion, and a severe opacification on his chest x-ray on the right side. Diagnosed pneumonia. He gave him a ton of fluids, started antibiotics, put him on a ventilator, but he wasn't getting better and wanted to send him to us. Sure, send away. An hour later the gentleman arrives and looks young, fit, and not the type to just drop dead from pneumonia. We roll him onto our stretcher and find a huge stab wound in his back. The x-ray finding was his entire right chest full of blood. We put a tube in it, gave him back some blood, and he had to go for surgery to fix the bleeding. Lesson: look at your patient. From the time I was 13, I had a growth on my thumb. It became so big that it affected my piano playing. I went to the doctor about it, and he diagnosed it as a wart that had been there for nearly a decade. He used acid on it. That hurt, and did nothing. He used an electrical instrument to burn it. That really ducking hurt, and again did nothing. I moved to the UK and was at a dinner party a friend was hosting. She was a nurse, and many of her friends were nurses and doctors. One of the doctors, a surgeon, saw the wart on my thumb and became very excited. He called to his wife, a nurse, to come see. He told me that he couldn't diagnose me because I wasn't in clinic, but to make an appointment with my GP. I did, and was diagnosed with a neurofibroma, a type of tumor that develops around a nerve. I had surgery to remove it. It was the size of a lima bean. Thankfully, it was benign, but no wonder the wart treatments hurt like a Sonova beach.